Everyone, Dr. Nate here. I am here to give you long-term solutions to lower back pain that does not include more surgeries, more injections, more procedures, more drugs, all that type of stuff. If you've had pain for a while, the answer is probably not more surgeries. It's probably not all of these different little things. There are a lot more things you have not tried, I promise you. I have these conversations every single day with people. And I'm going to share with you over the next 30 days literally everything I know about lower back pain. And based on your comments and your questions, I will make more videos about this very topic. Stick around till the end of this video because I'm going to share a quick story about a patient I had who thought that he needed surgery, and he ended up not. He was actually better within a few days, 10 days to be exact. That's not the case for everybody, of course, but this is his story, and I'll share that at the end. But first of all, I just wanted to jump in and talk about degenerative disc disease, stenosis, spondylolisthesis, and a bunch of other things. You know, there's facet hypertrophy, facet stenosis, annular tears, disc herniations, all that type of stuff. Whatever your X-ray or your MRI says, it has to match with your symptoms. Most things that we find on the imaging, most back issues, are treatable non-surgically. That does not mean that you don't need surgery. There are specific reasons when surgery is a good idea, particularly when there's weakness or numbness or tingling that's getting worse that goes down the leg. That is when surgery is more effective. Usually a laminectomy will be done in that case. Or some other procedure. But when it's just centralized back pain, and people try to go and get like a fusion for that or some other small like disc procedure, it usually doesn't end all that well. And each subsequent surgery actually has worse outcomes. So the more you get surgery, like the more desperate you get, the worse the outcome becomes. So the solution can't be getting more surgeries. The solution can't be just endlessly getting injections, although that might be a part of the management of your plan of care. The solution has to be something else. And we're going to go into those solutions in future videos throughout this series. It'll come up, up on the left or the right later on in this video. It should push you towards the next video that talks about different things related to lower back pain. But let me share the story with you now. So I had a gentleman come in a few years ago, and he had been moving a heavy printer. He was probably about 55 years old, somewhere around that age. And he'd been moving a heavy printer and didn't really have any help. And he tried to pick it up, and he immediately felt a strain in his back. It completely seized up. Now, you might have had this experience. Maybe it was lifting something heavy. Maybe it was even doing something very simple, like crossing your leg or picking up a sock from the floor. He was in excruciating pain, like 9 out of 10, 10 out of 10. So he comes into the office, we do the clinical examination, and he asks me a question. He says, I got this x-ray, which, by the way, you should not get an x-ray early on in your plan of care because it actually leads to worse outcomes and doesn't really give us good information unless you've had a fall or like some sort of trauma. But anyways, he came in and he was asking me about what his x-ray said because it showed that he had severe disc degeneration and he also now had back pain. And you might think that the two are very tightly correlated or they match really closely, but that's not necessarily the case. It's actually the opposite, where his issue was that he lifted something heavy and he wasn't prepared for it. His body was not prepared for it. He doesn't usually lift heavy things, and so he strained his back, right? But what can happen, and what I often see in this scenario, is that people go get the x-ray, they see that they have a broken or damaged spine, or an awful looking spine, or a crooked spine, or whatever you want to say, and no one explained to them that was normal, that was actually a normal part of aging. Now, I'm not saying that it's not the cause of pain with some bulging discs and some disc degeneration, but it is not very tightly correlated. And most of the time, even if that was the cause of the pain, it's very treatable. He was better in 10 days. And that's how an episode of acute low back pain should go. It shouldn't be somebody turns into one who's having chronic and persistent pain symptoms and issues, because that is much more complicated to treat. We're going to talk about that later on in the rest of the series. But he did better, and the difference with him and many others is that he asked really great questions. So if you can learn to ask great questions of your healthcare providers, next time you get an x-ray and MRI, please ask them what that means and how often does this happen in a normal population that doesn't have pain. If you ask those questions, you're going to get much better answers. We have to be advocates for ourselves, because no one else is going to do it for us. I hope you have a wonderful rest of your day. I will be putting out lots of new videos in the coming days, actually every single day after this one. So if you're watching this series in the future, good to you. You can just binge it. If you're watching this in November of 2020, one video is going to come out a day. Okay, so please drop your comments below, like and subscribe if you enjoyed this video and learned something from it, and I'll see you in the next video.